Welcome back, Chronics, and thanks for joining me. Today we're talking about POTS and stomach problems.
Hopefully it's not stomach problems again.
Most of us with hypermobile EDS probably have POTS, so trying to distinguish where the stomach issues are coming from.
That is really a hard thing to do.
Kind of called out her colleagues in that I think she sees patients from all over the country because not everyone diagnoses POTS. Pretty much no one.
Still a total mystery.
So she started to see a pattern with these patients after getting a whole background on their whole medical history and really listening.
Listen to me, medical people.
The doctor who gave the lecture I watched, Dr. Laura Pace, really awesome, and she found most all of them complained of
Horrible things, but things I'll live with.
brain fog, headache, dry eyes, dry mouth, heart palpitations. The stomach symptoms that these patients were presenting with, also similar, ranging anywhere from trouble swallowing, pain, nausea, diarrhea, upset stomach. Is that already the beginning of a Pepto-Bismol commercial?
When you have nausea, heartburn, indigestion, diarrhea.
And she said all the patients she sees, given this blanket diagnosis of irritable bowel syndrome, said IBS, those are symptoms. It's not any condition that causes these symptoms. It basically, if they give you that diagnosis, it means they just don't want to look any further.
Oh, snap!
When she explains this to other doctors, she also has to explain the autonomic nervous system and show them handouts or visual aids. She said, "This isn't a psychiatric problem." And she kind of laughed as she said it. Basically being like, you morons, you're telling your patients they're crazy.
Not insane.
When they have very real symptoms. Cool.
It's not my fault you didn't listen.
Then she talked about what specific tests we should have to determine if it is POTS or another form of dysautonomia that is giving us our stomach problem.
I need to do some tests.
First, you need to test the motility, breath testing, often called a SIBO test. She said because antibiotics actually...
It may exacerbate your condition.
People should be treated instead with a statin. She then talked about doing an endoscopy and looking for mast cells. When she does an endoscopy, she takes samples of the tissue and sees if there's mast cells present.
It's all connected.
She talked about median acute ligament syndrome. Some of us with EDS can have a compressed celiac artery. So if you're experiencing horrible pains after you eat and the doctors are like, "Meh, we don't know. You're probably crazy."
Another terrible call.
Have a CT angiogram. These are all great things to know, and all the symptoms that are from EDS I did another episode on.
Thanks, that does give me some hope.
So check that one out and see which symptom goes with what. It's like a fun game.
More like a record store full of nightmares.
Thank you so much for joining me. Hit like and subscribe. So remember, Chronics, educate yourself.
Help us, help you, help yourself.
Be true to yourself.
Enjoying learning to live my own truth.
And don't take crap from anyone.
Not today.
I will see you guys next time.